Welcome to the endocrinology short reviews, and today we are going to discuss the disease named as Hashimoto Thyroiditis. Hashimoto Thyroiditis is most common cause of hypothyroidism in which autoimmune or autoantibodies are formed against thyroid gland, and it is also known as chronic lymphothyroiditis. So when autoimmune disease in which autoantibodies react against antigen of thyroid against antigen variety of thyroid gland, thyroid antigen, then hypothyroidism occurs, and it is more common in female gender, predominantly 10:1 in female. It is associated with HLA-DR3 and HLA-DR5. Anti-thyroid peroxidase, anti-TPO antibodies becomes positive, and antithyroglobulin antibodies are also positive in Hashimoto thyroiditis. So, what are the complications associated with Hashimoto thyroiditis? The complications associated with Hashimoto thyroiditis are beta cell, non-Hodgkin lymphoma, autoimmune adrenalitis, type 1 diabetes mellitus, and myasthenia gravis are also associated with Hashimoto thyroiditis, because these are disease in which autoantibodies are also formed, and these autoantibodies react against body's own tissue and cells, causing different type of the disease: beta cell, non-Hodgkin lymphoma, autoimmune adrenalitis, type 1 diabetes mellitus, and myasthenia gravis. What are the clinical features of Hashimoto thyroiditis? Is it is caused by antibodies, so there may be general clinical features like patient will gain weight, increase weight result because of despite of decrease appetite and cold intolerance, fatigue. These complications indicates the features of hypothyroidism and Hashimoto thyroiditis. Patient will have hypothyroid, and skin clinical features are dry skin, dry hair, and alopecia, loss of hair of the patient. Heart includes diastolic hypertension and bradycardia will be complained in the patient. Diastolic hypertension will be there. And neurological clinical features are carpal tunnel syndrome. Patient will have delayed relaxation of reflexes and depression. In neurological clinical features, reproductive features includes menorrhagia, heavy menstrual bleeding, infertility, and impotence to the patient. GIT, gastrointestinal disorder, GIT complications includes constipation and ileus to the patient. So these are the clinical features of Hashimoto thyroiditis. It is strongly associated with the HLA genes, and it presents with the hypothyroidism. So patient will have clinical features of the hypothyroidism like weight gain and decreased appetite, cold intolerance, fatigue, alopecia, carpal tunnel syndrome, menorrhagia, impotence, and constipation. So that was short review of Hashimoto thyroiditis.